So go ahead, Melissa. I think you were going to introduce what we're doing today.
Yes, so I will give you some of the nuts and bolts. As Patrick mentioned, the ONTPD boot camp we hold annually in the fall, preceding the AAP NCE, and it started out as a program to get new PDs and APDs kind of boots on the ground, understand how to learn the ropes of their new job. However, it's grown into something that even experienced PDs and APDs really enjoy going to do some networking, sometimes commiseration, and to learn about topics. So we recognize that there are a lot of topics that come up for PDs and APDs, but also new APDs as they're going through kind of the life cycle of what it's like to lead a fellowship program. So as Patrick mentioned, we're using the timeline that is posted on the website as kind of a guide. And then we wanted to have deeper dives into some of the important timely pieces of the life cycle. So today we've chosen the ACGME survey. We are going to use this forum we've invited some people with special expertise and knowledge in that area, and we're going to have a moderated panel discussion for about 10 to 15 minutes. That section will be recorded and then posted, so it will be a resource of a composite of all of these different videos of these different sections, so new PDs can find out more detailed information about these different topics if they go to the website and click on the timeline. So with that, I will let Brooke introduce our speakers and the topic.
So I want to first thank our speakers. So Lindsay Johnson is the first person. She is the Associate Professor of Pediatrics at Yale. She's the APD, but was the Program Director for many years at Yale. But she's also the director of all fellowships in pediatrics as well. She serves on the ONTPD exec committee and on the Neonatal National. Not anymore. You're done. Okay. She's done. But she is on the
a happy ONTPD member.
Yeah, ex-ONTPD member. And then she's on the Neonatal National Curriculum. Melissa Scala, we asked her to join us today because she's done a lot of work in wellness, and a lot of the ACGME survey revolves around questions regarding wellness and how do we address that. She's an associate professor of pediatrics and neonatology at Stanford. She is the Stanford program director. And also, I think you also work on the Neonatal National Curriculum. Is that correct?
I've done some stuff, but yeah.
And then we invited Kathy Bendel, who is an associate professor in the Department of Pediatrics at Minnesota. She is also the vice chair of Equity, Diversity, and Inclusion. She is a longtime pediatric fellow or neonatology fellowship director, and it appears that she is also the program director for all fellowships in pediatrics as well. So I think that we have some good expertise to kind of talk about the ACGME survey. As many of you may be aware, the ACGME survey is being released on the 28th of February. It's a little different this year, and I think they did it the same way last year, but it used to just be it was released on a certain day, and it was sent to all trainees based on when it was released for pediatrics and stuff. This year, the program directors have to go in, or your coordinators have to actually go in and release it on sometime during the window that it is open. It is going to be open until April 17th. So you have about 7 weeks that it's open, but they did that this year instead of just releasing it on block to everyone so that you could kind of see what's going on in your program. They didn't want it to be, some programs are experiencing a huge COVID surge and they felt it was not the right time to release it, but you do need to release it sometime during the course of the 7 weeks with the expectation that it will close on the 17th. One of the biggest things that the ACGME is looking for is your response rate. So making sure that all of your fellows respond, and you can actually go to the website to see who has responded and who hasn't. And also any faculty members that are considered core faculty will also be receiving the survey. And it's also really important that you reach the threshold, and I think it is 80%. if I'm not mistaken. I think that you get dinged if you don't get 80% of your faculty and fellows responding. So that's the most important thing. So keeping track of that, of who is responding and who isn't, and getting on them to make sure they respond. The survey is used by the ACGME to help with determining your accreditation status. And they feel that this is an anonymous way. We all have very strong feelings about, is it core faculty again? It is core faculty, but in my program, all of the neonatologists are core faculty. So it is all of them. It's more the bigger programs like pediatrics in general that they pick it because they can't send it to the 200 faculty member in pediatrics. If that answers Megan's question. But it is used for accreditation purposes. And so we do know that we don't know exactly what the questions are that are asked or how they are asked. That is never released to us. But we do see themes every year. So with that, I am going to open it up to the questions that were pre-set. And I am going to start with Kathy, asking her, what is your process for preparing your faculty and fellows for the ACGME survey, if any?
I've learned that I need to prepare them. So, and I think it's good. And, you know, there's people that think, oh my gosh, you know, you're teaching to the test, right? Or you're not telling people how to answer the questions. But I think some of the questions are very ambiguous. And of course, you won't know if they're asking it the same way this year as they did last year. But at least if you look at last year's questions or the topics and try to address them, particularly any areas where you might not have scored as well as you did in the past. And so I do a combination of things in that I use our faculty meeting and our fellows conference to tell people the things that I think are really important about it and the response rate, that this isn't one of those surveys you can blow off, that you have to do it because it's really important. And I have my division director supporting that as well. So everybody knows that this is a requirement and we know who doesn't answer, so they know. And then we talk about any particular areas. And so, you know, some of those questions, like some of the faculty don't know what we do in orientation. So they don't know if they've had training on sleep deprivation or if they're getting QI and, you know, QI training and what's happening. So reminding the faculty of some of those core things that they're asking about that may not be always on their radar. And I found that super important because we have faculty, our fellows rotate in a number of different NICUs, and they rotate through another NICU in the Twin Cities where the faculty are adjunct faculty at the university. They're not part of all of our meetings. They don't know what happens. And they added a whole bunch of new faculty a year ago. And a lot of those core questions, we dipped a little in our answers that year because these new people didn't listen to my email or maybe didn't even get it if it didn't go the right way and didn't know about it. So I think paying attention to some of those things that they might not know what they're really asking for, like some of the ones, and then also anywhere that you had a lower score than you wanted to, because you should have been this year already following up on it, but reminding people what you've done to address any of those so that you don't get, everybody's super busy. And this is in our forefront of our mind all the time, but it's not in the rest of your group's mind. And they'll forget, even though you told them 2 months ago that we addressed that work hour thing or whatever it might be, and they've just forgotten it because it's not part of their thing. So it seems repetitive sometimes, and it seems like, do I really have to tell them again? But you do. You need to do so pull out your email, your script from last year and use it again and update it and change it. Those would be my key things.
Anyone else, Melissa or Lindsay, have something they want to add to that?
Yeah, I would add, we've really done a lot of what Kathy had said in terms of right before the survey is going to be going out. We actually put together a presentation of the areas that we identified that we didn't perform as well as we had wanted, and listing all of the things that the fellows had helped us to come up with. So we really look at it as a partnership. These are the things that you guys helped us to identify. This is what we've made improvements on. And you can oftentimes feel really impressed by the amount of work that was done in the intervening year. Just like people don't remember getting feedback, we try to use the names of things. People were telling us they hadn't had exposure to adverse event analysis, and talking with my QI people, they're like, we do this every single month during this one conference. So we renamed the conference to be named adverse event analysis. So hopefully those things are going to be helpful in allowing people to remember all the hard work that you've done.
Yeah, and Lindsay, to follow up on that, sorry, is that the thing about the RCAs too, you know, we have a definite process. Every fellow in the Department of Pediatrics gets to participate in an RCA sometime during their training, but the faculty just don't know it, you know? And so that's another one to call out to people.
Just to mention to everybody, our GME just reminded all of us, and I thought it was such good advice, to make sure that you go in and look at the list of fellows and faculty that are going to be receiving the survey, just because if you've had people who have retired, who have gone on to other institutions, or who aren't working with the fellows, you don't want them to be included in that list of who's getting that. So an important thing to check and make sure that all your fellows are in there and that their email addresses are appropriate is going to be helpful as well. So you're not tracking down people who actually haven't been receiving it or who received it in error.
Let me add one more thing, which is we do all these things that you guys are talking about. It's a great way to showcase the work you're doing, because a lot of times we're sort of doing thankless tasks, I think, behind the scenes, and people don't know what we're doing. But I feel like increasingly we live in a Yelp nation where people are used to going on social media and just blasting or venting. And so I usually say to my faculty members, this is not a restaurant. We have to take this very seriously. And if you don't know, email me, ask me. I go over all these things we're talking about. But I say this isn't a place to vent or be grumpy. If you want to vent or be grumpy, here's my cell phone number, my email. And the other thing is, this is answered on a Likert scale. Answer that not two things to the ACGME is a violation, okay? And people, depending on their personality, may not really get that, right? So that sometimes, or something that a middle answer to the ACGME is a violation. But a lot of people, their whole mental frame is like, well, things happen sometime. And so you have to sort of understand what you're communicating to the ACGME when you say, no, this isn't happening, right? And I never say to lie. I mean, I want them to be honest, because how else am I going to learn and make my program better? But they need to understand the mental frame of how the ACGME happens to be interpreting these questions. So,
yep. I think that's a super important point, Melissa, because sometimes the way the question is worded, it's interpreted very differently by a scientist. I mean, really, than the way the ACGME is saying it. And the other thing that you said that I think is really important, that I remind my faculty and fellows multiple times throughout the year, is that I know our program's not perfect. I know there's things that we need to improve upon. And so I want to know about those in real time. If there's something going on, and it's reported in the survey, that's fine, but I don't want that to be when I learn it's a problem. From the survey, I want to have known in advance that it's already a problem and be prepared to figure out how we're going to work on it.
Well, you guys have touched on this quite a bit about how you deal with previous surveys, but Lindsay, I'm going to turn to you and ask, how do you process and act on the survey results?
With a lot of help, I would say. I think typically I sit and look at it on my own and digest it. And I like to make lists and write things down and brainstorm on my own about what things we have in place, to address each of the areas that have been identified. What are some potential new things? And then I'll sort of go to different groups. I work very closely with Christy Bruno, who's my colleague and the program director. So she and I will usually talk together about our priorities. And then we'll sort of go to a group of other faculty members, including our chief or our director of research, depending on what the areas are. And after we've sort of had a chance to think things through, then we'll meet with the fellows and sort of talk it through with them. In a lot of cases, I think it comes down to confusion about the questions and wording, and maybe them not being as attentive to interpreting those. Like, oh, well, you guys had indicated that there was some concern with this. They're like, oh, no, that's not the case. Okay, so it's really, really important to try to prepare on the front side to be very, very careful. But with them, we'll sort of go through and make a list of potential strategies. And then every month that goes by at our fellows meetings, we'll have a section of that cordoned off to talk about how things are going with those interventions, if there's anything new that's come up. And then at Yale, we do program evaluation committee meetings every 6 months instead of annually. So we have nice opportunities to meet together with a group of fellows and faculty to check in on how things are going. So I would say I'm doing it with a lot of partnership. And when we have had things that were sort of outside of our division, there's been a lot of willingness to help in terms of talking with our vice chair of education, talking with the department chair, talking with the GME leadership. So depending on what the areas are, being very willing to go out and get some additional consultation to see how things could be best addressed.
That's great. Kathy or Melissa, do you have anything to add to that?
I would just add, I mean, what Lindsay said is a great summary of the same sorts of things that we do. The only thing I would add is that, you know, with this new way of reviewing us every year you know, there's all the information that you put into web ads, but in reality, it seems like the RRCs are spending a lot of time looking at the results of the survey. So that's why it's really more important than ever to have the survey really reflect what's going on in your program. So when we're talking about acting on it, you know, I'm very careful to really make sure in web ads that we're addressing anything that was a concern in the survey and explaining to the ACGME how we're addressing a particular problem. And as you've all probably realized by, you know, we're neonatologists, right? You want to fix everything immediately and get everything done. But some of these issues can't be fixed immediately. It's going to take time. And the ACGME is really all about process. So, you know, you may not have it fixed by the time you're responding, you know, because we'll get our results in May and June maybe, but hopefully May, but then you got to turn around and get all your stuff into web ads. And so as long as they know you're not blowing it off and that you really listen to the things in the survey and that you're trying to figure out how to address any of the problems, that's what they want to see. They want to make sure that you're acting on the problems.
Yeah, that's all about the same things that we do. I learn a lot from talking to other people. So any problems that show up on the survey, going around and certainly talking to fellows, but talking to the head of our NMP group or you know, other faculty members, and then trying to make sure you've got the support of your division chief if you're going to try to wrangle the faculty into doing something, getting everybody on the same page. So yeah, you guys are doing exactly what we do at Stanford.
All right. The next question, I'm gonna kind of jump. How do you deal with the challenging areas on this survey? And the biggest ones that we tend to see is impact on other learners and then practice habits. Those seem to be the ones that are the most difficult for how do you coach people with regard to that? I'll go with Lindsay on that one.
I was going to say Melissa should go first. She hasn't gotten to, but I'm happy to.
Melissa's doing the wellness. We have one set for her.
I'm happy to. So I think the impact of other learners is one of the things that we typically spend a lot of time talking about, because that's something that's a common area of conflict. And Melissa is leading a working group to sort of explore this area more, which is why I thought she'd be great to touch upon it. And she'll probably have more to say. But I think really working collaboratively with the fellows, as well as those other individuals, leaders, to try to navigate the situation. We were having tremendous issues with procedural allocation, specifically around intubation, and we had made more finite instructions about who's going to be responsible for taking the airway at what time of the year, just so there wasn't a lot of infighting, and that really helped things a lot. So just being really forthcoming about talking about that and trying to navigate the areas that are real pain points or big challenges. The practice habits are another thing that we talk about labeling. So whenever we would have the fellows semi-annual meetings, we would say, this is the discussion on your practice habits. And we really looked at procedural numbers to account for that. Taylor Sawyer and me and Heather French and Ann Ades, I think, did a survey a couple years ago looking at typical numbers of procedures that were done by fellows at each year of training. So we said, we're going to use that as sort of a baseline benchmark. And we would look at each fellow's procedural log and sort of compare to that published data. Not perfect, but for me, it was something that was reasonable. It was numerically oriented, but labeling this, when you take the survey, they're going to ask you about your practice habits. This is us reviewing your practice habits. So things had gotten better for us after addressing it in that way.
We also review our Vaughan data and some of the other ways, because it is a group practice, no matter how you look at it, which is a little different than some other areas. And so knowing how the group is doing in comparison to the, using Vaughan, so you have the national numbers and you have the numbers for your type of NICU, helps them then to understand how we're working together as a group.
So I guess I got to say something about other learners. So this is a huge problem I think all of us have, is how you support education in our newly morphed, well, not newly, it's sort of been slowly morphing this way, like a different construct with different types of practitioners, and with the paucity of procedures and problems with role clarity and varying experience levels. So we have been meeting as a work group that's multidisciplinary, with program directors and fellows and nurse practitioners and PAs all together to try to come up with some recommendations to help other people, because we've sort of been brainstorming this and sharing common experiences. I think trying to figure out what your pressure points are and making some concrete plans around them is probably the simplest summation of this. That, and also sort of reorienting the whole group to the fact that it's not one group versus another, but that everyone is showing up to work every day, trying to do the right thing, trying to take great care of patients, trying to learn. And it's really, in the analogy of marriage counseling, it's really us against our problems rather than one group against another. And sometimes it can people can get caught up in a way of thinking about these things that isn't really productive to creative problem solving. So I guess sort of more to come and more details, but I would just tell everyone who's listening to this that you're not alone. That all of us are dealing with this in some form or another. So I think we'll just start to work on it as a group going forward.
I love that. I got to learn some, I've never heard that marriage counseling analogy. That was really great. So Melissa, we're going to keep you on the hot seat. Because of your expertise in wellness, how do you deal with the wellness portion of the survey?
Yeah, this was I guess a relatively new thing that they started doing, but I think it's really important. And the rates of burnout in our specialty are pretty significant. I mean, we deal with some pretty heavy things on a day-to-day basis. Patients who are dying, high acuity parents who are in incredible amounts of emotional distress. And the other thing that is sort of interesting about how we've done things over the last, certainly 10, 15 years is there's this increase in amount of feedback, which is good, right? I mean, we all need to hear about where we might improve and do better next time and do better for the babies. And at the same time, there's a lot of focus on QI and clinical outcomes and making sure we're doing the best thing for the patients. All of this is good. But what's happened, I think somewhat inadvertently, is that we have this incredibly emotionally intense experience and a situation where people are almost constantly telling you what you did wrong, with almost no training in how to deal with that, right? And I think for those of us who have gray hair that we've either decided to cover up or not, we were sort of taught to just, put it in a box and put it away and don't process it. And then we decided, okay, well, what we really need to do is just be thankful and happy. So that's just sort of like putting a bow on the box, right? Sorry, there's construction below me, if anyone can hear that. So I think these are things that we really need to start thinking about really at a national level, how we program around this. And it can be hard the first time you get that wellness survey and you're like, oh my gosh, my people are an emotional disaster. My faculty is an emotional disaster. And how am I going to even handle this? I think there are some small things you can do. Certainly, I think initial first steps are always, things that are the typical wellness things. I'm not trying to belittle gratitude and meditation and taking a break and social events, because those are all wonderful. And sometimes it's just the small thing like the availability of a Cliff Bar in the call room that can actually make someone's night just feel a little bit better. So I encourage you to certainly try those things. But I think to really get at a deeper level of it, you have to start thinking about teamwork and psychological safety and how you build those things in your program, and providing mental health services, and maybe even some regular meetings with your fellows and mental health providers to give them a frame to try to process all of these things that so many of us were told, well, if you're strong enough, you can just get through it, right? And sometimes we have to do that for a shift, but that can't be the lifestyle, okay? Because it starts to seep out of your pores, gives you health problems and makes you grouchy and other things. So I think that's my rant on wellness.
That was really great, Melissa. Do either of the other two panelists have comments about wellness or any closing comments before we close out the moderated portion of this?
I would just say I've been so impressed by our current trainees and their openness to having mental health assistance. I feel like most of my fellows are very, very open about the fact that they see a therapist or are interested in seeking counseling. So we are able to provide that through GME, which has been really, really great. And for me, just being very upfront and asking them how they're doing, and if anybody's going through something, being very directive about suggesting if they haven't spoken to someone, being able to provide them those resources, which is something I agree with Melissa, no one ever did for me during training. And I can say I was a big hot mess and I probably would have really benefited from that. But I do think that there is much more of a willingness and an acceptance to have that help, which is really awesome to see. It's a great change that's been coming about from this just awareness and willingness to talk about things.
I would agree with everything Melissa and Lindsay said, and especially what Lindsay was just saying about the openness of the fellows. And I have to tell you, our wellness surveys from our fellows are really actually very good in my program. It's the faculty I'm really worried about. That first one I got back and I was like, oh my gosh, what are we going to do? And there's so much more evidence for burnout. So what I think has been really interesting, and that is eventually going to trickle down to all of the trainees, right? You can't be a good teacher, you can't be a good provider if you're having trouble. So I one of the things that has come out of this in our program is a lot more attention to, are we really practicing what we preach and taking care of ourselves and each other as colleagues in our division, and not just always watching out for the trainees, and to not only appreciate the openness that Lindsay was commenting on, but to practice it yourself and to think, well, if it's okay for them to do it, it's okay for me too. It's not just, I'm still got to be that stoic person that I was taught to. It doesn't matter if you have to work every other night call for a month, because that's the way you did it when I was an intern. So, and we've really made some really great strides, I think, in terms of addressing some things to help make our faculty wellness scores hopefully improve, not to make the scores improve, but by actually addressing some of the issues for the faculty.
All right, well, we would like to thank everyone for joining. If anybody wants to unmute and ask a question that you want on the record, please go ahead and do that now. And if not, then I think that we will stop recording and just allow a time for people